Thank you, Dr. Fleming. I appreciate the opportunity to be here tonight to express my feeling about our cause to save Medicare. And I've been taking care of patients in northern Michigan in a rural setting for the last 30 years. And it certainly means a lot to my patients to have Medicare there to help them get through some their medical problems in their elder years. And, you know, I'm kind of surprised that I've been castigated for voting to end Medicare, when really I voted to try to save Medicare because of the crisis that's coming forward because of the demographics of our country and the pending bankruptcy of the Medicare Trust Fund. Now, as I see it, there's like really 4 reasons why Medicare is in trouble. Number one, there's an increasing number of patients on Medicare every year. There's 10,000 patients a day are added to the Medicare. You know, there's like 50 million people today that receive Medicare. In 20 years, I think the number is 80 million people. Well, that's one reason. The second reason is there's like a little over 3 persons paying into Medicare for every person receiving that benefit today, but in 20 years there will be a little over 2 people paying. So not are there going to be 30% more people, there's going to be a third less people paying in. The third problem, of course, is just general rising costs in medicine. And that's an issue that I think our plan to save Medicare, a premium support plan where there's options in your insurance, will help keep those costs down. And of course, the fourth problem is the Affordable Care Act. You know, the Medicare that people are familiar with today, seniors that today have, that's not the same Medicare going forward, because the Affordable Care Act has taken $575 billion away from Medicare. That's over $100 billion from hospitals. I think it's like $40 billion from home health care, $30 billion from hospice care, and over $100 billion from the Medicare Advantage. Well, I know in my rural district, we have many small community hospitals that depend on their Medicare payments, and $100 billion taken from each of those small hospitals. You know, those hospitals operate on a razor-thin profit margin. If we take that money away from my small hospitals in my district, they may not be there tomorrow. So how is my senior population going to come see me? They won't be able to come to their local hospital. They may have to go to Green Bay or Marquette, or, you know, drive hundreds of miles to get evaluated in an emergency room, for example. This is not, you know, the way things are now is just not sustainable, especially with the Affordable Care Act impact on Medicare. And to think that if we do nothing, everything will be okay is just wrong. You know, we put forward this plan of a premium support where you have a choice, just similar to Medicare Advantage, where in Michigan there's 20 or 30 different plans you can choose from, the one that suits you the best. I think that's a reasonable option. There may be others, though, that maybe another plan out there somewhere that's equally good. I haven't seen that, but I'm certainly willing to listen to a plan of how to fix it. But the mere fact of doing nothing is unacceptable. And I just think that it's just wrong to castigate those of us that are trying to find an answer that will fit most people and be affordable, and, you know, like many of the advantages that people have talked to previously this evening, you know, differences in different people's situations. To do nothing, though, to put your head in the sand like an ostrich and pretend there's no problem, is not an option. So, like many before me speaking, I encourage people to speak to their physician about what the situation is. I'm going around my district this next coming several months and putting together a little Medicare meet and greet, you know, at the senior citizens centers, at you know, various locales of my district, to try to explain this to the patients, because they don't really seem to have an idea I say patients, I guess I mean constituents, but speaking in the doctor terms, they don't have an idea how serious the problem is. And I think that's part of our problem, is getting that message out to the people that this is not something that we can ignore. This is not something that's just going to go away by not dealing with it. And this is certainly not going to go away by castigating people that are trying to find an answer. So I encourage those people, as Nan mentioned, to speak to their physician. Feel free to call my office to get further information, but realize that we're trying to fix a problem, not ignore a problem. Right. So with that, I'll yield back.
Okay.